This video was created by fourth-year nursing students at UBC Okanagan in partnership with the Healthy from the Start program. This presentation will provide a brief summary of Interior Health's Healthy from the Start program. What is Healthy from the Start? Healthy from the Start is a one-stop shop that connects pregnant women with services in their community to help them have healthy pregnancies. All pregnant women are encouraged to call Healthy from the Start's toll-free phone line to speak with a public health nurse. The public health nurse will complete a screening and provide an opportunity to ask any questions that the woman may have. Although early registration is not required, it is encouraged so that women can be connected with services early in their pregnancies. Women who call in are able to have questions answered, receive important information, and feel supported throughout their pregnancy by nurses and other community services. They also receive a free copy of Baby's Best Chance.
Unique aspects of Healthy from the Start. There are 3 different ways clients can get in contact with the Healthy from the Start program. They are able to phone in, sign up online, or be referred to the program by a nurse, physician, or community provider, for example. The phone interview is based on motivational interviewing. It strives to fit the assessment into the interview, not the interview into the assessment. By doing so, the phone call takes on a very client-centered approach. The phone calls are very adaptive and based on the client's voice, needs, or concerns. Each interview is unique and left open-ended for the client to direct where the conversation will go.
The phone call. Typically, the call is 30 to 45 minutes, depending on how much chatting the nurse and the client get up to. A public health nurse is available Monday through Saturday, and if the client can only talk in the evening, the nurse will do her best to arrange for this time. Healthy from the Start is available to all women, so if someone doesn't have access to a phone, the nurse can help arrange for the client to use a phone in the community, such as at the doctor's office or a local public health center. Some open-ended questions the public health nurse may ask the client during the conversation include: what's the client's health history? How is her pregnancy going? What's her nutrition like? Is she planning to breastfeed or formula feed? How are her finances and what is her housing situation like? Does she have questions or concerns about mental health? Does she have support systems? The nurse will also ask about intimate partner violence because 25% of women have experienced abuse in past or present relationships, which can have an effect on pregnancy, labor, and delivery. The nurse asks about this in a way that is supportive and non-threatening. The public health nurse is letting the client know that she's there to support her if she decides this is something she wants to share and talk about at this time. If the client doesn't want to talk about this, that's fine and the conversation will move on. The nurse will ask if the client is interested in prenatal education. If so, the nurse will give information about where local classes and education are. The nurse will also ask about the intended birth facility, the estimated due date, and lastly, any specific resources the client would like to know about or any other questions the client may have.
After the phone call, the public health nurse sends the client an email with all the resources that they talked about during the phone call. The public health nurse first confirms that email is an acceptable way of communication for the client and emphasizes that this is the only email they will receive from Healthy from the Start, other than perhaps a follow-up survey email later on. The resources in the email are tailored to meet the woman's needs and are specific to what is available in the woman's community. Each woman's email will look different because it will only contain what the woman is interested in and what she agrees to receive. The public health nurse is very clear as to what resources she will send the woman and only sends the one that the woman wants to receive. This way, the woman doesn't just get a generic email of all the resources available, as this can be very overwhelming and not useful to the woman. If the public health nurse feels that the client has more complex health challenges, there may be a follow-up arranged to be completed by other public health nurses.
BC Healthy Connections Project. The BC HCP is an evaluation conducted by the Children's Healthy Policy Centre at Simon Fraser University. The evaluation looks at the effectiveness of an intensive home visiting program called the Nurse Family Partnership. NFP has been designed to help disadvantaged young, first-time mothers and their children. When women call in to Healthy from the Start, they are screened to see if they are eligible to enter the study. If they are eligible and give consent, they will be connected with the BC Healthy Connections project. If they participate in the study, they will then be randomly selected to receive the intensive intervention or offered other appropriate public health services based on their needs. For more information on this study, please visit the website listed above.
You can direct clients to register online at www.interiorhealth.ca/healthyfromthestart, or you can print off the referral form available online and fax it to 250-868-7809. Women can also self-refer. If you have any questions, you're encouraged to call the Healthy from the Start phone line at 1-855-868-7710 or email healthyfromthestart@interiorhealth.ca. For more information on Healthy from the Start, please visit www.interiorhealth.ca/healthyfromthestart. For more information on the BC Healthy Connections project, please visit www.healthyfamiliesbc.ca/home/BC Healthy Connections project.